Well, good morning. It's absolutely fantastic to be here in Murray Bridge for an historic day. I'm joined by quite a large group this morning, including Professor Nicola Spurrier, the Chief Public Health Officer and also the advertiser at Sunday Mail Woman of the Year, Stephen Wade, the Minister for Health and Wellbeing, the two local members, state and federal, Adrian Pedrick and Tony Passon. I'm also joined this morning by Dr. Carolyn Fagan, who will be the very first person in Australia to be administered with the AstraZeneca vaccine. Carolyn is the Director of Medical Services here at the Riverland Mallee Coorong Local Health Network, and she's joined today also by Wayne Champion, who is the Chief Executive. So we've got a lot of people here because this is an historic day for Australia with the first administration of the AstraZeneca vaccine. We know that this is a very important program for our nation, and we are super pleased in South Australia to be the first place in the nation, and this will be administered to frontline workers here in this LHN. 1,000 doses were received yesterday, and within 36 hours of this vaccine being received into South Australia, we're already starting the rollout. South Australia has led the way in terms of our response to the pandemic since day one. First of all, with our sky-high testing rates here in South Australia, then the fantastic rollout of the QR codes. I mean, we have at the moment in South Australia 1.3 unique users of the QR code system. We only have 1.3 million people above the age of 18, so a massive take-up, and now we're leading the way in terms of the vaccination rollout. I know that the Chief Public Health Officer has repeatedly said that what she would like to see in South Australia is that we have the highest vaccination rates in the nation. We're certainly doing everything that we can to make sure that it is going to be a very successful vaccination program for our state. A lot of early work was done last year within SA Health, more work done early this year, and of course now we're moving through in a risk-oriented way through stages 1A and then moving on to 1B.
In regard to a target, obviously we were given 20,000 doses. When do you hope to have all of those administered by? I know with Pfizer there were 12,000. Do you hope to have those done within 3 weeks? There's still a week to go on that.
Yeah, well, look, we've been naturally cautious and wanting to get it right rather than rush, but we're still on track to administer the Pfizer vaccine, now of course the AstraZeneca vaccine. And of course there are many advantages of the AstraZeneca vaccine because it doesn't have the same cold chain logistics complexity of the Pfizer. The Pfizer vaccine, I think everybody now appreciates, needs to be stored at -70. We don't have those restrictions with the AstraZeneca, and that's great for regional Australia. It's particularly great for regional South Australia because we're a very large state and we need to get those vaccines out to very remote places, and the AstraZeneca presents us with a great opportunity to do that far more quickly.
So having set a target though, for when those 20,000 doses will be used?
The 20,000
of AstraZeneca?
Yeah, look, the reality is we are moving through that at the moment. I can ask the Health Minister to go through further detail of that in a few moments. Are there any other questions?
Why Murray Bridge did we get the guarantee to be the first in the country?
Well, I think a lot of planning was done by SA Health last year and this year. We were ready to go. We didn't want to hold it up at all. And look, our frontline workers in South Australia have been rolling up their sleeves, looking after the people of South Australia through this entire global pandemic. Now they're rolling up their sleeves to take the vaccine, and we're really pleased that it could be done first in Australia, right here in Murray Bridge at the Murray Bridge Soldiers Memorial Hospital.